Hello and welcome to the channel. My name is Peter Truick and I'm a UK-based physiotherapist. Do you have knee pain? Well, I do. And so does up to 45% of the people between the age of 18 and 35 years old. Just a quick disclaimer, this video is not for the people who've had a traumatic injury, surgery, or if you're under the age of 18. If you have had a trauma, then stop watching this and please go and get it checked. Just a couple of things to look out for before you start. Is your knee locking? Now for this one, we are talking about true locking, when you bend it and it catches mid-range and you can't straighten it again. This could indicate a meniscus injury. Or is your knee giving way? Not because it hurts so you take the weight off of it. Is it sliding out from underneath you or translating? As this could indicate ligament damage. Or is the pain vague and you're getting pins and needles, tingling, numbness or loss of muscle control? If you're getting this could indicate more of a neurological pain. This video is for the most common type of knee pain we see as physios. That sharp pain right in the front of the knee that came out of nowhere. You feel it when you get up after sitting for a while, it lasts a few steps and then it's gone again. Or as soon as you kneel down or when you're walking down the stairs, it just reminds you that it's there. If you look around the gym on leg day, there are generally quite a few knee wraps or sleeves floating about. More often than not, these people have experienced some form of knee niggle. The most common question I get is, can I train through it? The answer is usually more complicated than a simple yes, but for most of us we can. But first we need to understand why it's there. The knee, albeit simple in terms of movement, is quite a complex joint and a lot can go wrong with it. For today we're looking at patella or kneecap loading. If you sit with your legs straight and relaxed on the couch, you can wiggle your kneecap about. If you bend your knee, although still relaxed, that kneecap becomes a lot harder to move, and I'll demonstrate this later on in the video. This shows that there's load through the kneecap and therefore load through the quadriceps. The knee joint is influenced by what's going on at the hip and the ankle. The key to being able to solve it is understanding and knowing which of these two joints is the guilty party, or could it be both of them? Right, time for some self-assessment. I'll see you in the gym. So we're on to the self-assessment bit. Now for this, it's not as accurate as getting a physio or someone to do the assessment for you, but if you don't have access to a physio or you just want to have a look yourself, give these a go. So to start off with, we're going to look at your hip. So you've got two options and we'll go through them both. The first is to lie down on a mat or on your bed or on a table, wherever you like, on the carpet. Get a phone behind you, get someone to film it. And what we're going to look for in this position, we're going to lift one leg up. And we're going to rotate it out, and you can actually do them both at the same time, and you can rotate your hips outwards. Try to keep the front knobbly bits of the hips level, so you don't want that to happen or that to happen. So just try and make sure that they don't move as you move, and then you can look for any differences right versus left. I'm pretty sure last time I checked I had a slight restriction into internal rotation, so that test is for hip internal rotation, and I'm pretty sure my left is slightly less than my right. So we'll head over to the bench for the next one. Alright, so I know I said bench, but I think the box is going to be a better height for me. The reason is the bench, I'm sitting with my hips more flexed or more bent. So what we want to do is on the box, we want to do the exact same test. Now this will test in hip flexion that was in a neutral hip position. So basically with your hips bent out in front of you like you're marching them versus a straight line. So exactly the same test, we want to rotate outwards and have a look at the angle of your shin. Now try not to let your knees move out, so keep them nice and neutral. Hip width apart is a good place to start, and just rotating outwards. Brilliant. From there you can do a rotation test inwards, but an easier way is just to do a classic piriformis stretch. So again, try not to rock too much with these two knobbly bits at the pelvis, so we don't want any compensations through the spine. Basically, that's why I'm telling you to keep these points quite still. And we're going to look at the shin angle relative to the midpoint. Right, and then you do the same test. I know this one's restricted on my left, and you'll see that clearly in the video. I mean, this one's quite obvious. So, and I'm lifting at the hip to high, so there we go. All right, that's going to be a good demonstration. Brilliant, we'll head on to the next one. So we're on the mat for the next one. Now, just a quick reminder, these are not to check your range of movement. These are going to be tests to aggravate. So what we're looking for is a pinch in the front of the hip or tenderness in the glutes, or one of the two. The only one that you can use for a little bit of self-assessment is going to be the Faber's test, so the external rotation, and we'll go through that in a second. So for these, what we're going to do, lying on your back, bring your hip into flexion, so that's the FA in Faders or Faders, right up as high as you can, and then we're going to bring it across into adduction, so that's the ADD, and then you're going to try, grip on, and internally rotate and look for any pinching at the front of the hip. Now for me, I do get a little bit of a pinch. It might be better if you have a partner for them to do this one for you. So same thing on that side, up, across, and then internal rotation is actually taking the ankle outwards, and that will rotate the hip inwards, and this hip I don't have anything going on there. The next one is the opposite. So resting your ankle on your opposite knee, similar to what we did in the piriformis stretch, and just let it drop. Again, trying to watch for spinal compensation. And then we're looking for any discomfort around the hip area. And you can use this one, as I said, for range of movement. As you'll see, my right's got a lot more. Brilliant, we'll head on to the next one. So the last of the hip joint testing that we're going to do today is more of a strength test, so looking at how you feel. We're looking at feeling fatigue or feeling, I don't think we'll be feeling any pain, but if you do, then that's not a good sign. You might get a bit of a muscle cramp, or you could just do a max time hold, right versus left, until you can't hold it anymore. But hopefully we've got nice strong glutes and you'll be able to hold it for too long. So just do a set time, say 30 seconds, and see if one feels completely different to the other, or if you're not getting the feeling in the top back of the hip and you're getting some compensation in the front. We really want your glute medius, which sits at the back of the hip, to be firing. So start off on your side in neutral side lying, so ankles, knees, hips, shoulders all in one line. You can bend the bottom leg if you like. Then I suggest taking this back just slightly, not so much that your spine arches, but just so you've got a little bit of hip extension, and then raising it up and holding it, and see how long you can hold it for. What you don't want to do is get compensation coming forward and you see how everything's shifted out of line. So you still want that nice straight line, and you should be feeling this one right in there. And then you do your max hold, or you do your 30 seconds, and see how that feels on that side. And then you roll over and you do the exact same thing, and try not to let your hips rock forward and backwards too. So you want to, if anything, keep a slight forward rock. And you can put your hand on your hip to feel it. Brilliant. So that will be the last of the hip testing. Alrighty, so you've done your hip testing and you found a problem. We're going to go through a couple of things on how to fix it. So let's take, for example, you did the testing and you found, oh, I've got some stiffness into internal rotation at the hip. We'll go to my favorite. So the banded joint mobilization. You want a really thick, heavy band for this. You don't want a lightweight band. This has got to distract your hip slightly for it to work. So step into that band, anchor it on something strong, and put it right up as high as you can into your groin. And then you want a huge amount of tension on it. So it's as you can see, I mean, this is really pulling me. And from there you want to mobilize, I might have it a bit tight, but into internal rotation, and then coming forward into flexion. So bringing your knee inwards is going to set you into internal rotation, and then forwards is going to work into that flexion, while the band is almost pulling your hip joint out. And you can do sort of 3 sets of 10 of these, go to the end of range there, feel the stiffness in the hip and do a bit of a bounce. You can even push your knee inwards with your hand. And you can do, as I say, 3 sets of 10 of those. Try and test and then retest afterwards. So if you have that stiffness, do some banded joint mobs, and then go back to the box or go back to your bed and recheck the range of movement. Right, the next thing you can do, and I'll have to give a shout out to Aaron from Squat University for this one. I've been using it with a lot of patients and had really good results from it. It's called a kettlebell hip shift. So grab a kettlebell, ideally a little bit heavier, We're going to go into a lunge position, but a side lunge position. And from there, we want to drive our knees backwards. We don't want them to come forwards as we move. So rotating out, rotating through the tibia and abducting from the hip. From there, grab onto the kettlebell, and all you're going to do is shift inwards until you get that pinch. You'll almost feel it pinching in that left hip. And again, you can do that little bounce at the end of the range, or you can go further out. And there I'm feeling more of a pinch. Now if you come forwards, it's going to feel a bit weird, so make sure you pull in that knee back so you have a nice straight line, and then working into it. Brilliant. The last one that you can do for a stiff hip is what we call the hip 90-90. So sitting down, go probably 1.5 to 2 times your hip width apart with your ankles, and you're going to start off with loose hips, rocking in and rocking the opposite leg out. Do those a few times, get the hip joint moving nicely, and then what I'd like you to do is stabilize through one hip and drive the other one in. Now this one again you should feel in that hip joint, and again you can bounce at the end of the range. So instead of going in, out, go to the end, feel the stiffness, and repeat the movement. Really important that we're not opening the hip for this one, that we're trying to mobilize into internal rotation. And lastly, you did the glute strength test and you found, right, my left glute had no power compared to my right. What can you do about that? Well, my favorite go-tos are crab walks and side planks. So, band of your choice. I would say if you've got a thicker band like this, place it above the knee. And then if you've got a smaller band like this, place it below the knee and around the ankle, just because of the lever length of your leg. So the lighter band's going to feel heavier at the bottom and the heavier band's going to feel lighter at the top. With these, I like to do them in a ladder form. So key pointers are you can have soft knees. What you don't want, again, those front knobbly bony bits on the hip. Don't let them rock too much, so you can watch yourself in the mirror, or you can just pop your hands on them. From there, screw your feet into the ground, switching on the glutes, and keep your feet at 90 degrees. What you're going to notice is if you've got a real weak hip or real weak glute med, is your foot's going to rotate outwards as you go. So we want those feet at 90 degrees, stabilize the pelvis, don't let it move too much, and we're going to go one to the left, followed by one to the right. Always slow controlled movements, and always keep tension on the band. If I go in there, there's no tension on it, it's not doing anything. So start off with tension on the band and work into more tension. And then go 2 to the left, followed by 2 to the right, and then 3. You see where this is going. And I've got to watch my foot because I know my left hip externally rotates, which is why to the right I don't mind too much, but to the left I'll always be watching it. Another thing, don't let your foot drag, and try not to really go on with your toes. Try and land with a nice flat foot and transfer. Then I did mention it, the side plank. Brilliant exercise. Now for this one you're going to think, well, the leg that's moving, because I'm going to do it with a clamshell for all you gym rats who I know are a bit stronger. The leg that's moving is not going to be the leg that we're targeting. So if I wanted to target my right glute med, I would lie on my right side. Now for those of you who aren't strong enough, do a bent knee variant, and sometimes the bent knee variant is better anyway. So what we're looking for, we don't want to bend at the knees, hips and shoulders. We want knees, hips and shoulders all in one dead straight line, raising up, and then you can add in your clamshell. Now the beauty is you can do this on both sides, but focus on the side that you're struggling with. What that does is it trains the glute med to stabilize the hip joint, and that's the main function. Your glute med is not some, well, it's quite a big muscle, but it's not some massive prime mover like your glute maximus. Its job is to stabilize the hip joint, so we need to train it as such. Righty, so the hip's done and dusted, and then we'll head over to the knee. Alright, so onto the knee test. We're not going to go through all the special tests of the knee, there's no point, but there's only one that's going to have some relevance to you, and that's the patellofemoral grind test. Not my favorite test. I wouldn't often use this on patients in clinic because there are enough other markers, but again, I know what I'm looking at. So if we go there, straight leg, relax the quads, make sure you can move your kneecap. Okay, from there, you want to push your kneecap down. So feel it, let it move around, push it down, and then you want to slowly tense your quads. Now, don't just crank out your quads, because if it is positive, you'll fly through the roof. It is a nasty, sharp pain in the front of the knee, and I get it on my left, which is why I'm being a bit ginger about this. So pushing that kneecap down and forwards. Yeah, even that, you see that little tense, that causes a really sharp pain in the front of my knee. Yep, so yeah, not a nice test, and be ginger with your quad movement. If I go on my right, for instance, where I have no issues, I can crank that kneecap down and I can crank my quads out, full tension and nothing. So yeah, it's not the most pleasant test, but if you haven't found anything else, give that a try, and that will confirm that this is your knee pain. If you find nothing with all of this, then your knee pain might be caused by something else, and then it's definitely worth getting it checked out. Right, so that's a special test done. What we can also do is feel the kneecap, and this is why I say that when you bend your knee or when you're kneeling down, you're putting load through the kneecap. So in this position, I'm nice and relaxed, I can wiggle my kneecap around, no problem, and you can do the same thing. However, if you place something underneath your knee, like a dumbbell or a towel, and you have a slight bend in your knee, right, and I'm still going to relax, this is why I'm not holding it up, so the muscles are still relaxed. You can see now it's just the skin that's moving. That kneecap is hardly shifting because there's load through the patella, load through the quads. And that is why if there are issues with your biomechanics, then you might find issues with your kneecap itself. Alright, so for the next test, yes, I'm cut in half and there's a reason for it. I really want you to look at what's going on at your foot, because we're going to do tibial rotation. Now you've got 3 points in your foot. You've got the base of your small toe, base of your big toe, and then your heel. Try and keep all 3 points in contact with the ground. Now there's not a lot of tibial rotation at the knee. Most people won't even know it's a movement of the knee. They'll just think extension and flexion, but there is some tibial rotation. So in sitting, lock your knee out with your hands, really hold on to it, and keeping those 3 points in contact, rotate inwards until you feel this big toe lifting up, which mine is about there. And then you do the exact same thing with the other leg, which is about there. And then look on the camera or just visually look down, and yeah, I can see my left is restricted. Right, the next thing we're going to do is do the same thing, so lock it in, and we're going to go outwards, and same thing there. And again, slightly restrict, actually quite a lot of restriction, that's more than I thought I had. But yeah, so same 3 points on the ground, but with this one your little toe is going to lift off, so make sure you just keep that nice and flat. And don't do that, what I've just done there, as I let go of my knee, so lock the knee out, rotate, lock the knee out, rotate, all points in contact with the ground. Alrighty, so you've got a restriction with your tibial rotation at the knee. What can you do about it? So grab onto a band. Now a thin band is going to be better for this one. And again, I have to give a shout out to Squat Uni for this exercise, works brilliantly. What you want to do is pop the band under the knuckle of the big toe. So place it in there, and you don't want it too far under the foot, so you can roll it in a bit. And you want to put a little bit of tension on it. The idea is that if that lifts, the band shoots out. So place it under the big knuckle of the big toe, so like that. And now what we want to do is we want to drive our knee outwards and then come forwards, and you can keep driving it outwards and work in and out of that, and you can change the angle of your leg too. So you can do, see mine lifted off, you can do your lunge or like a mini lunge with that in position. Trying to force that tibial rotation, because when we get into the depth of the squat again, we require that tibial rotation to maintain our arch height and to give us better technique in the squat, allow us to have more depth before our lower back or hips have to compensate. And what will happen if you lift off, bang, band comes out. Alright, so for the next one, we're just going to do one test for the ankle because it's the most common thing that goes wrong with the ankle, and that is a restriction into what we call dorsiflexion, so that movement of your shin over your toes. So the easiest way to do this is find a wall, put your big toe up against it, heel flat on the floor, again those 3 points in the foot flat on the floor, drive your knee forward, right, that easy, so come back a little bit, do the same test, keep doing the same test, and you can also do it in standing, but for this video we're going to do it in kneeling because I've got a larger restriction, so there I'm not quite on it, so I just can't make it. So creep your foot forward to about the point where you can just get it before your heel lifts. Make sure that heel doesn't lift. You can even pop your hand on your ankle holding it, but try and keep it down yourself, so that feels quite easy actually. So sorry, the box is moving. I would say that's close to my limit. Now what you can do, match that exact point with your other leg, and here we're going to find the restriction. So, and that's it. As soon as I get past that point, I get a pinch in the front of my ankle and my heel lifts off. I hope you can see that nicely in the video. I'll zoom in for you, but that's all I've got. So if you want to do the finger measurement method, I'm probably around 2 fingers, no, my heel's lifting there, probably around 2.5, 3 fingers from the wall. So that is enough to cause a problem when going into a deep squat where we need that knee over toe movement. I'll exaggerate it. So when I would squat, so I've got a heavy bar on the back and I want to go nice and low, what will happen is my right knee will translate forward, causing a hip shift, spinal rotation, and then you end up in that sort of movement, and that can cause problems with the lower back. Alright, so you found you've got a restriction into dorsiflexion of the ankle. What can you do about it? Again, we're going to go over to old faithful banded joint mobilizations. If you're not getting a pinch in the front of the ankle and you're getting a pull at the back of the leg in the Achilles region, do bent knee calf stretches. So driving your knee down or driving your ankle down, bending your knee forward, and you should get a stretch through there. Or you can just do a standard calf stretch where straight leg pushing back and down. That might stretch a bit higher up, more into gastrocnemius because the leg's straight. But you can do either one of those or hang it off a step and do the same stretch. But most likely it's going to be a pinch in the front of the hip and a restriction if you're watching this video. So get a nice heavy band. Again, you don't want anything too light. And what we've got to remember is the mechanism at which the ankle works. So simply put, you've got your horseshoe from the 2 knobbly bones on the side of your ankle. Those come from the bones above and they create that horseshoe over the ankle joint. Then you've got a bone on the top of the foot which sits around there. And as you move your knee forward, you need that bone to drop down slightly so clear space. If it doesn't drop down, you get a bit of an ankle impingement. That is worded quite simply, but that is the basic mechanism of it. So what you want to do, we'll go onto my right ankle just because the video camera's on that side. And again, this must be heavy, so challenge yourself. Trust me, your joints are really strong and they're not easily going to be moved out of place. The key things here, you want it underneath these knobbly bits on the ankle, and you want it pulling back and down slightly. So once you've got that back and down pull with the band over the front where that bone is and going below the knobbly bits on the ankle, I'd probably want this anchored a little bit lower, and from there keeping your heel down, and you're just going to drive over. I would say for this one there's no magical sets and reps, and this is probably going to be a journey more than a do it once and you're good to go. For instance, my left leg, I've been doing it for the past 5 years and I've gained about 60% of the movement back. So keep doing it. It will be a journey, but there are things that we can do, and we'll go over those in a second, that can help you still train with this issue. So when looking at your knees, we look at the overall biomechanics. Now you'll often hear this term when it comes to knee pain, and what that means is the relationship between the hip, knee, ankle and foot. Now we won't go too much into the foot today because we'll use the hip to influence the foot. We won't work from the bottom up using the foot to influence the hip. That is a lot more technical. But if we look at the knee specifically to start off with, what you want to see when you do your squat, when you do your lunge, or when you do, we'll do it a pistol squat because I know my knee gets unstable with a pistol squat. What we want to look for is any wiggle in the knee. So it's a short, quick side to side movement. I don't think it will do it in a lunge. No, that's not too bad. Single leg squat, again, not too bad, but I know I can get it to do it in a pistol squat. And I know I've got an ankle restriction, so I'm using the wedge to get rid of that. So in a pistol squat, what we're going to see is a huge knee cave where the glutes run out of steam, and then we're going to see the glute firing and not firing, causing a little instability at the knee. So the right leg you won't see much, so if I do it on the right leg first, nice straight, or a little bit there actually, but not too bad, right at the depth of the pistol. And on the left it's going to be a lot more clear. Oh, it actually wasn't, so there I just had the glutes off completely and it drove inwards. Let's try again. There it was, so a little wobble, very difficult to pick up on. Right, the next marker that you can look at is what's happening in the arch of your foot. And I know we said we're not going to look at the foot, but if you stand there, this will teach you the relationship of biomechanics. Just stand up nice and relaxed and squeeze your bum. And look at what happens to the arch of your foot. And remember, do all of these barefoot. So squeeze your bum, and bingo bango, you've got great arches. So, but flat feet are still perfectly functional, so don't worry if you have got flat feet. What you want to see is if you go down into your bodyweight squat, what is happening at the arches? Are you dropping in on one side? Are you rotating your foot outwards? A foot rotating outwards is a limited ankle mobility 90% of the time. Foot dropping inwards is a weakness or your glute just not firing. So those are markers that you can look for. After you've done all the testing, try your bodyweight squat and see what you can find. Now, if you have got the foot dropping in, grab a band, tie it in a loop or get a loop band. I suppose we can just use a loop band for this. So pop it round. Start off with it above the knees. And now the goal is, as you squat, you're not trying to snap the band in half, you're just trying to drive your knees outwards. So there, and see if that makes any difference as to what's happening at the foot. If you're still collapsing inwards, try drop the band to just above the ankles, and we're going to retest the exact same thing and see if we're still caving inwards. Hopefully one of these two options will have fixed that cave. You can also do a similar thing in the lunge, so have an anchor point, anchor the band, make sure it's pulling your knee inwards. So I'll be the anchor point for this, but I recommend tying it to a bench or a squat rack and driving your knee out as you go down, and that will force your glutes to switch on as you bend your knee, hopefully correcting the overall biomechanics of your leg. And if you are getting pain in the lunge, that can even take the pain away. Alrighty, so you're a gym rat, you love training legs, but you can't because your knee pain's limiting you or worrying you, or it's only certain movements that hurt. Well, what we're going to go through, and we've touched on it briefly, is some things that you can do in the gym to try and get rid of it. So, and that is to train through it, not to get rid of it, because getting rid of it's going to be long term. This is going to be to allow you to train through it. So the first thing is with your squat, as we've just done, pop the band around and see if you do have pain on a squat. See if just putting the band up high or putting it down low can take your symptoms away as you squat, forcing your glutes to activate, and make sure we're not getting a knee instability, a bit of a wobble. There was a whole thing on knee cave in a squat, but if you go watch the world record powerlifters or any powerlifting competition, when they're squatting to their max, as they push out the hole, you get a massive knee cave. Now that is because your adductor muscle group are very strong and they pull your knee inwards. So when you've maxed out the weight and when your glutes and everything else is fatigued, they will kick in to help out. And that's not a problem at all. That is not an indication of an knee instability, right? But if you are getting that with a body weight squat, that can be an indication of a glute weakness, and that we can address. So by putting the band around your knees, you're forcing the glutes on, and that should align your leg in a better position. If, however, you went to the ankle, the knee to wall test, and you found, well, I've got an ankle restriction, and it's causing a shift in my squat, and I'm getting some lower back and knee pain, what can you do about that? Well, the easy solution is put a wedge under. So you don't need a yoga wedge like this, you can just use a plate. So pop a plate underneath your ankles or two small plates And there we go. And now that's put your ankle in slight what we call plantar flexion, and that's taken out the mobility, allowing you to squat really deep with really good technique, and it takes all the stress off the front of the ankle. Alright, so let's say you get pain in the knees on a front squat or on a normal barbell back squat. There is a slight tweak that you can make to your squat to allow you to still squat heavy and take out that knee over toe movement to some degree. Now we do want that movement, we do need to be able to get that movement, but while you can't, swap your traditional high bar, and I hope I'll be able to do it, I'm quite restricted. So let's say you go to your traditional high bar squat, you lock it in, you step back, you find your comfortable squat position, and you go into the squat. So what we should get there is a knee over toe movement, right? And I feel quite a restriction in my left hip. If you go to your low bar squat, so instead of doing your traditional high bar squat, if you place the bar almost across your rear delts, use them as a rack, especially when you've got more weight on it, what that will allow you to do is get more of a hip movement and less of a knee over toe movement. So there you can work backwards into that hip movement position and come up from it, and I hope you can see that. My knees don't translate much over my toes. Again, there are some restrictions there, but interestingly, when I get the bar weighted up, those restrictions, they ease off, which shows me it's joint tightness, because as we put more load through it, those restrictions tend to go away and it does free up the squat. But as you've seen from this video, I'm quite a long way off squatting properly with perfect technique. But that's okay, my goal is to get there. And hopefully one of these days I will get there, and then I'll show you guys this video and show you where I came from and where we got to. If you're like me and really enjoy your unilateral training and want to do lunges, but lunges really hurt your knee, well, I've got some good news for you too there. So let's say you've got a bar or weights and you're stepping and you're doing your lunges. You see how we get that massive knee forward drive, putting pressure through the front of the knee? Simple fix, stand in the front and do your step back lunge. Now we don't have that massive forward drive over the knee, and it will still allow you to put a huge amount of weight on the bar or weight in your hands or wherever you like to do your lunges. So you've seen these tests, you've found that you've got a knee problem that is related to the biomechanics of the lower leg, and you need to get back to kneeling. Let's say you lay carpets and you really need to be, or you're an engineer and you need to get into small places to access things, or work in PC, or you have to plug things in, or whatever the case may be, and you need to be able to get into this position without any knee pain. Right, I've got the biomechanical deficits as you've seen from all the testing, but I'm now able to do this, where this time last year I could almost guarantee you I would not be able to do that. It would have been too painful. And the way I've done it is through the exercises that I've described here, really trying to focus on hip and ankle mobility, strengthening up through the glutes, and then the last key is working to that knee over toe movement. So the first one we're going to start with is one of my favorite. And locking that foot in, screwing it into the ground so you get good biomechanics, placing your opposite leg up in the air, keeping all your weight on that side, gently dip and lift up, try not to hip hitch, so dip down. When that gets too easy, you can pull out a step, or go into your last step at home, or last step of the stairs at home, and if that's too high, put some books underneath or a pillow to set yourself a target, and you can do that. Same movement, just on the step, and try not to hip hitch, try stabilize through the pelvis and work through the knee, driving forward over your toes. We need that knee over toe movement. Now, one I didn't use very often until the past probably 3 years is backwards walking on a treadmill, or sled pulls that you can do with a cable machine, or if your gym has a sled, that's perfect, do backwards sled pulls. But even just backwards walking on a treadmill with the treadmill off is going to be fantastic for knee over toe movement. It basically reverses the movement that we've just done, and it is quite nice because there's no load through it, or no load, there's minimal load through it. The next one is one we've been using in clinic for a long time, and that's a reverse Nordic. So be wary, this one can hurt some people especially. So if an exercise like this or the previous one hurts, go back and do the exercises that we discussed earlier. And if you're not coming right with them, please go get it checked out by a professional, because everyone's body is going to be slightly different. And the issue causing your knee might not be one that we touched today, because we've basically done the greatest hits of what we see most often. Right, so for the reverse Nordic, You want to be in that position, lock the hips out, lock the shoulders back, and all you're going to do is lie back. Now, if you can get to there and it's pain-free and you pull up, that's perfect, work there. If you can, try and work your way down to being able to go pretty much all the way and then coming back up. That's about as far as I've worked up to. Again, for me, that movement is 100% pain-free. Don't feel anything other than my quads lighting up. So the biggest one that everyone wants to get, and all you gym rats wants to get, especially if you do watch the knee over toes guy, is the sissy squat. Now, work your way up to the sissy squat. It's a great exercise. It's one that last year this time, there's no way on this planet I would have been able to do it. But now I can pretty much just drop down into a sissy squat. My balance let me down there. But I can do reps of sissy squats and not have any issues in the knees at all, which is fantastic, and I love it. And the way I did that is I set myself a target up against the wall and I did mini sissy squats. I found the point where it hurt, so there would have been a point early on if I had gone to there, or I would have felt that a little bit in the knee. So I stepped a bit closer to the wall to allow less range of movement, and I worked in a pain-free range. And I kept taking small movements back from the wall. I used to do it up against my bed actually, so stepping back from my bed, driving my knees into it and working back. And over the course of around 6 months, I built up to a full-on sissy squat, which is quite brilliant for me. I was really proud of it. And the fact that I can drop down anywhere and do one now is brilliant. The other exercise that you can look at is an ATG lunge. You can do it with weights. Again, this is from the knee over toes guy, and it's basically a really big knee forward drive lunge. Now for me, I have to lift my ankle off to get this movement because I'm quite restricted in the ankle joint, as you've seen. But if you can do it with your ankle flat, it will actually help improve your ankle mobility. But yeah, I'll lift the ankle up, and you can also do it on a step. You get a great hip flexor stretch on the other side, and you get that massive knee over toe drive, which we all want. And we need to be able to do. Us as humans need to be able to drive our knees over our toes. Now, to address that elephant in the room, or should I say the mountain on my left knee for those wondering. It's a childhood condition called Osgood-Schlatter's disease. Basically, it happens in teenagers who do a lot of sports, and it's a pull of the quad tendon on the attachment of the tibial tuberosity, which is that bony bit that we all have in the front of the knee, which just happens to be near growth plates, and it forms a very painful bony growth. Mine just happens to be massive, as it was misdiagnosed and diagnosed as growing pains, and I was told to wear full knee brace. If you're wondering, my lopsidedness pretty much stems from cricket. I've rolled my left ankle in footholds more times than I can count, and the nail in the coffin for the poor fella was when I fell off the high bar in the gymnastics hall trying to do some calisthenics. The hip is all from bowling. This is my landing side, so there's a lot of force going through it. I often wonder which came first, the hip stiffness or the Osgood-Schlatter's, but this is for another day, and we'll head back to the topic. These exercises will work for a lot of people. Which ones you choose to do will be based on the accuracy of your assessment. The aim is to get your knees feeling bulletproof. If this is not achieving it, or it's ramping up your symptoms, then please get it checked out by a professional. If you're a beginner looking for a workout, then please go check out my beginner training video. If you have another joint giving you trouble, let me know down in the comment section below. Thank you very much for your time. Now if you like the video, please smash that thumbs up button and subscribe so you don't miss out on any future videos. Until then, I'll see you in the next one.